This short video explains the correct procedure for taking a patient sample for pre-transfusion testing and seeks to highlight the risks and consequences to your patient if you do not follow the correct procedure. The Serious Hazards of Transfusion Reporting Scheme have identified a number of cases where incorrect blood component transfused incidents have occurred due to errors made at the sampling stage of the transfusion process. The majority of these incidents are caused by human error and could have been prevented. They are not necessarily the result of any lack of care or professionalism. Mistakes often occur due to factors outside our control, such as distractions or the working environment. By understanding and practicing the safe blood sampling procedures illustrated in this video, we can all ensure that mistakes do not happen. If you are a doctor, nurse, midwife or phlebotomist, and part of your role is to take samples for pre-transfusion testing, it is your responsibility to follow the sampling procedure correctly. There are a number of steps in the sampling process that are known to be high risk or error hotspots. These are steps in the process where the procedure must be followed correctly, or the consequences for the patient could be fatal. It is essential that these hotspots are completed with particular care and attention. The hotspots are identifying the patient, labelling the sample tube, and matching the blood sample with the request form. The following scenario highlights the risks and consequences to a patient if you do not follow the sampling procedure correctly. Dr. Walker has been asked to take a preoperative group and screen sample for Anne Brown on Ward 2, who's been admitted for cardiac surgery. In the doctor's room, he checks the patient case notes, writes out a request form, and prepares the sample tube with the details he's taken from the patient's notes. He goes to find Anne Brown on the ward. He approaches a nurse and asks her which bed Mrs. Brown is in. The nurse replies that Mrs. Brown is in the bed on the right in the first 6-bedded room. The doctor approaches the bed and says, "Good morning, are you Mrs. Brown? I'm here to take a blood sample, if that's okay." To which the patient replies, "Hello, doctor, yes, that's fine." He goes on to bleed the patient and returns to the doctor's room where he puts the sample in completed form in a transport bag. He places them for collection and transportation to the hospital transfusion laboratory. When the sample arrives at the specimen reception, staff will check, is the integrity of the sample tube intact? Does the sample tube and form contain the minimum patient ID? Are there any discrepancies between the sample tube and the request form? Note that many hospital transfusion laboratories operate a zero-tolerance policy, and if any discrepancies are found, the sample will be rejected. The sample is accepted, and a unique laboratory number is assigned. Staff also check the laboratory computer records to see if the patient has a historical transfusion record. Upon testing the sample, the biomedical scientist finds a discrepancy between the sample received and Anne Brown's historical transfusion record. She telephones Dr. Walker immediately. The biomedical scientist explains that the sample that was sent for Anne Brown, date of birth 16th of June 1968, tested as Group A. Yet her historical transfusion record indicates that her blood group is Group O. This would indicate that the sample tube contained another patient's blood. In obtaining the sample, Dr. Walker had failed to follow the correct procedure, and as a result, he had mistakenly bled Joan Brown instead of Anne Brown. Misidentification of patients is an important cause of avoidable harm in all areas of practice and can have fatal consequences. In this particular case, had there been no historical transfusion record for Anne Brown, she could have received incompatible blood. This could have led to death or serious complications due to an ABO incompatibility reaction. The wrong blood group would also have been incorrectly noted on her patient records. Although a sample error was detected in this case, it still had consequences for both Anne Brown and Joan Brown. Joan Brown had an unnecessary blood sample taken. A second blood sample had to be taken, this time from Anne Brown, and there was a subsequent delay in Anne Brown's surgery due to the hold-up in preparing her blood. By following the sampling procedure correctly, the risk of making mistakes and endangering your patient can be significantly reduced. The decision to transfuse a patient is made by a registered medical practitioner or an approved non-medical authorizer. If you are responsible for completing the request form or electronic order form, you must check your local policy to identify the correct process. For example, does the request form have to be handwritten, or are patient identification addressograph labels permitted? You should understand that the following information should be provided on every blood request form or electronic request: the patient's first name, last name, date of birth, gender, and a unique patient identity number, such as an NHS or CAI number. The diagnosis and/or the reason for the request, including the nature of the procedure if the patient is having surgery. The number and type of component required. Any special requirements, for example, irradiated blood. A group and screen test, if this is appropriate. Remember, always state the date and time that the blood is required. Never use an ambiguous term such as soon as possible, as this may not convey the urgency of the request and may make it difficult for staff in the hospital transfusion laboratory to prioritise their workload. Other relevant information, which is of help to the hospital transfusion laboratory staff, is the patient's past transfusion, relevant medical or obstetric history. Staff may require you to clarify details of the request. Therefore, the person making the request must sign the form and provide a contact number. Every request form must also include the signature of the individual who takes the blood sample. This signature should not be added until after the sample has been taken. Identification of the patient, collection of the blood sample, and the subsequent labelling of the sample tube should be performed as one continuous, uninterrupted event at the patient's bedside. The Serious Hazards of Transfusion Reporting Scheme has identified that errors often occur because the identity of the patient is not verified correctly. When undertaking the task of identifying the patient, you must be aware of distractions and over-familiarity. Before drawing a sample, it is vital that you positively identify the patient by asking them, where possible, to state their first name, last name, and date of birth. You must then verify that the information provided is correct by checking it against the patient identifiers, such as the patient's identification band or the blood sample request form. Unconscious, paediatric or elderly patients are at greater risk of misidentification. For such patients, it is essential that you verify their identification details with a second member of staff or carer. All inpatients must wear an identification band or a risk-assessed equivalent. If you're taking a sample for pre-transfusion testing from a patient in the outpatient setting, where the patient may not be wearing an identification band, you should refer to your local hospital policy for advice. In an emergency situation, a sample taken from an unidentified patient can be accepted with an agreed identification dataset. The Serious Hazards of Transfusion Reporting Scheme have identified that errors often occur at the point of labelling the sample. Samples must be labelled at the patient's side, with details from the patient's identification band, to reduce the risk of using incorrect patient details. The sample label must include details of the patient's first name, last name, date of birth, unique patient identity number, for example NHS or CAI number, and gender. The label should also include the hospital ward, the date and time the sample was taken, and the signature of the person who took the sample. You must handwrite the tube unless you are using a computer-prepared label that has been generated by a barcoding system. The sample tube must be labelled after bleeding the patient. Current BCSH guidelines recommend that, unless you're using the barcoded system, you do not use addressograph labels on a blood sample tube, because this practice is more likely to result in inadequate patient identification. It is essential to spell the patient's name correctly and consistently, and to write legibly. You must never use a pre-labelled blood tube. That is, do not write the patient's details on the sample label in advance of drawing the blood. Never give unlabelled sample tubes to someone else to label, and never label a sample tube that you've not taken yourself. Once you have bled the patient and correctly labelled the sample tube, you must check and confirm that the details on the sample tube match the details on the request form. If there are any discrepancies, you must halt the process and investigate these before sending the sample to the hospital transfusion laboratory. Once you are satisfied that the details match, place the sample tube and request form into the transport bag and then place the sample for collection and transportation. You must ensure that blood samples are sealed correctly in order to protect staff that may handle them in the laboratory. Note that if the transfusion is required urgently, it is essential that you notify the laboratory by telephone and that you send the blood sample and completed request form using the fastest method. If using an air tube system to deliver samples, staff should ensure that they have been correctly trained in their use and that there is an appropriate delivery protocol for emergency samples. In summary, following the correct procedure and taking special care at each of the hotspots identified in this video will significantly reduce the risk to your patients. The next time you take a blood sample for pre-transfusion testing, remember the following hotspots. Identify the patient by verifying their first name, last name, and date of birth against a unique patient identifier. Label the sample tube at the patient's side. Check that the patient's details written on the sample tube match the details written on the blood request form. And remember, safe transfusion practice is your responsibility.